What do you wish people understood about your role in healthcare?
I think that part of the strategy that we are taking with Dr. B is to offer what I believe to be the most affordable way to access healthcare for many patients across the country. That means that we do not have hundreds of millions of dollars to spend on Super Bowl ads, subway ads, billboards, etc. So I believe that if everyone knew about the services that we have rolled out and will continue to roll out with Dr. B, they'll find that they're more efficient, they're more affordable than the status quo, and it would make many people's lives better. So I think what I wish they knew is just awareness for the company. I wish that every American knew about it because I think it would make healthcare in America significantly better.
Yeah, I mean, word of mouth is extremely important, but sometimes I feel like it will only get you so far because it's got to start somewhere. And you know, listen, I'm a keynote speaker, and I was just talking to someone about marketing the other day, and his thing is, well, my best marketing is to go out and speak. And he said, well, that's really good, except how do you find the places to speak if you need somewhere to speak before you can speak? Yeah, so it's, and in some ways what you're talking about is having your clients share the word with other people is extremely valuable, but it starts with having clients to begin with to be able to share the message. Does that resonate with you at all?
Yes, I think that that's true. But fundamentally, even at an early stage of a company's life, you can note that word of mouth can be incredibly powerful. Already at Dr. B, we launched only a few months ago. About a quarter of the patients that interact with us are coming through word of mouth, and we're starting to see that increase. So I agree, but I still think that it shouldn't be a precursor to starting and offering a service that's valuable and affordable for everybody.
Right. No, completely agreed. It's a cycle, and you've, like any cycle that exists, you need to start in order for the thing to move forward at all. And so don't let those the issues be an obstacle to doing something of value. So fantastic. What excites you about the future of healthcare?
So, I mentioned I didn't go to medical school, but I have 2 degrees in finance. And one of the things that I've been really worried about for a long time is just the cost of healthcare in a macro level. We talk about inflation a lot over the last 18 months in this country. Healthcare has had inflation this high for the last 40 years, and it's not sustainable. You've got 3 trillion. When I first started ZocDoc, healthcare was under 2 trillion, now 3 trillion, going to 4 trillion. I mean, it's really starting to pile up in terms of how much money we spend. And if you sort of play that out, it is clearly unsustainable. And so I want to have a sustainable healthcare system in this country. And the way to do that is, in my opinion, to make sure that patients are receiving the appropriate type of care, meaning through the appropriate modality at the appropriate time. I think there are some things that very efficiently can be managed through telemedicine, whether it's sync or async. There's some things that can be very efficiently, or needs to be done in an in-person office. But if you're starting with the most, using the most inefficient method to handle 90% of what's happening, there's no way for us to contain costs. So what I'm excited about is simplification of healthcare, where patients are easily navigated to the appropriate modality based on what they need. And the information across those modalities are available to all practitioners in a clear, structured way that enable the patient to have the best outcomes.